have shortness of breath often, you could be one of millions with atrial fibrillation, or AFib. It's a leading cause of stroke and congestive heart failure in the U.S.
As part of our Ask the Expert series in partnership with Bon Secours St. Health, 7 News' Jennifer Martin talked with a doctor to learn how to detect the condition.
Atrial fibrillation, or AFib, is a kind of irregular heartbeat that can lead to blood clots and cause strokes or heart attacks.
Make patients feel tired, short of breath, sometimes have chest pain, and overall a sense that something's not right.
Dr. Matthew Sellers says anyone with those symptoms should see a doctor right away because the longer you wait, the harder it is to treat it.
It becomes irreversible if it's not managed early. If you're a patient that has high blood pressure and sleep apnea and diabetes or heart failure or any combination of those medical problems, that you're at a much higher risk.
If that description fits you, Sellers says you may benefit from a defibrillator, which can detect AFib at its earliest stages.
In the past, it would take weeks, months, sometimes even years.
This year, Bon Secours St. was the first hospital system in the nation to use one of the latest defibrillator devices to hit the market, made by the company Biotronic.
It's much smaller, has a much higher battery longevity. Patients require less procedures to replace that battery.
Treatment can involve everything from blood-thinning medications to catheter-based procedures in the heart. But there are some lifestyle changes that help too.
Exercise, diet, weight loss, and controlling blood pressure and sleep apnea are probably the biggest things when it comes to managing AFib.
If you're in a high risk for AFib, Dr. Sellers also recommends keeping up with your annual physical exams and getting an EKG once a year. In studio, Jennifer Martin, 7 News.
To hear more from the experts at Bon Secours, you can listen every Saturday morning at 10 a.m. on 106.3 WORD Radio.